Thank you, Chairwoman Brownlee and Ranking Member General Bergman. And General Bergman, yes, as an Army veteran, I'm always ready. Dr. LaPuz, thank you so much for being here. In your testimony, you emphasized the use of telehealth. And as a physician in a rural area and a former Director of Public Health and a 24-year military veteran, it's very important to me. And since the pandemic, the VA has provided, on average, more than 40,000 telehealth visits per day. What lessons has the VA learned about providing quality care via telehealth in the VA and in the community?
Well, thank you very much for that question, ma'am. And what we have learned significantly from our telehealth experience, that first of all, that there is a majority of our veterans are amenable to having telehealth visits. So particularly those veterans that have experienced at least one telehealth visit. So what we have done is we have trained all of our providers to ensure that they are able to convince the veteran to at least undergo one telehealth visit, because the subsequent visits after that initial hesitation is actually, that acceptance rate is much higher. The second thing that we have learned is that for those that have gone through the telehealth, that they have a good preference to actually maintain the telehealth visits, although they are still requiring a face-to-face on occasion. So then that means that telehealth should not be exclusively offered, but be part of an option. And then thirdly, what we have discovered is that telehealth has a wide acceptance among VA providers, particularly among mental health providers. And that this is corresponding also to the acceptance rate of those veterans who are requiring mental health visits, and they have a good acceptance of a telemental health visit. And I'd like to turn over to Dr. Arfons for more.
If I can, I just want to follow up, and then I'm happy to have you turn it over. So as I mentioned, I'm a physician in a rural area, and also have, as a state senator, it was very necessary for us to get broadband and connectivity to not only veterans, to all of our citizens in Iowa. 15% of veteran households don't have the broadband to do a telehealth visit. And as we've seen, the VA has attempted to bridge the digital divide by providing phones and tablets to veterans who don't have internet access in their homes. However, that still has not materialized, and we know that there's an OIG report that is addressing this. But it is of concern to the Republican members of this subcommittee and of the Veterans Committee. This program has shown to be ineffective, as the phones and tablets have not been distributed, which also then brings up, are we wasting taxpayer dollars? In addition, I've also heard from veterans, and I think you addressed this, that they would prefer to have an in-person visit with their doctor. And as you mentioned, face-to-face is an option. You're not mandating that they have telehealth visits. So what's the VA doing to ensure that veterans have the option to visit with doctors or providers who they want to see, without worrying that telehealth will prevent them from seeking community care? And what's your stand on community care? As I said, I'm in a rural area, and so for some of my veterans, they're traveling an hour and a half to 2 hours one way in order to go to a VA facility to seek face-to-face care.
Dr. Arfons.
Thank you. Yes, so veterans always have the option to come see us face-to-face or telehealth. We never want to force them into only getting a telehealth visit, as you mentioned, if they're not comfortable, if they're not capable, or they simply just clinically need to be seen face-to-face. So that option is always available for them. We don't want to box them in. We do offer telehealth in the community as well. As Dr. LaPuz mentioned, often mental health can be delivered both within VA and in the community. So we right now have no restrictions on telehealth being offered in the community if that's easiest for veterans as well.
What about receiving community care?
Oh yes, they can receive community care in terms of.
And so you're not putting up barriers to individuals receiving care in their community?
No.
From a local provider who is available, ready to see them?
Correct.
Without a waiting period?
Correct.
All right. Thank you very much for your answer. I'm just going to say, as a 24-year military veteran, my husband is a 30-year veteran. 6 of the 8 children in my family were in the military. My father was an Air Force veteran as well. And as a physician, I have no higher priority than to ensure that quality care is provided to our nation's veterans. Thank you, and thank you, Representative Bergman, for yielding time to me, and thank you, Representative Brownlee, Chairwoman Brownlee, for holding this subcommittee. Thank you very much. I yield back.